Night shift at Cedar Hills Medical Center was always quiet until Maria Santos started working there. Not because she caused trouble, but because when real emergencies came, she moved like someone who had seen much worse, and her colleagues were about to discover exactly how much worse. Welcome to Hidden Legends. Before we dive into this incredible story, tell us in the comments what city you're watching from today. And hit that subscribe button. Maria Santos was the perfect night shift nurse. At 34, she had been working at Cedar Hills Medical Center for 3 years. She arrived at 11 p.m., left at 7 a.m., never missed a patient report, never arrived late, never complained. Everyone on the night shift loved Maria. She was calm, reliable, always able to find something that wasn't readily available. Patients found comfort in her gentle touch and quiet voice. Maria's partners were Jake Morrison and Lisa Park. Jake was a 28-year-old young paramedic who had been working in ambulances for 5 years. Lisa was a 31-year-old experienced nurse who had been at Cedar Hills for 7 years. But Maria was different. Her medical knowledge went much deeper than basic nursing. During emergencies, while others took basic vital signs, she performed deeper examinations. "Why do you look so closely?" they would ask. "Habit," Maria would say quietly. But this habit came from very different places. Maria's equipment checks were different from the others. She would inspect every tool with surgical precision: 4 needles, intubation equipment, cardiac monitors, as if she were preparing an operating room. Her colleagues sometimes found Maria's methods strange. "We're paramedics, Maria, not surgeons," they would say. Maria would smile and not answer, because actually, they were both wrong. Maria's depth of medical knowledge amazed even the supervising doctors. "Where did you go to medical school?" they would ask. "Different places," Maria would say, always vague, never details. And those places were very different from normal medical schools. That Tuesday night had started routinely. Maria, Jake, and Lisa were taking normal calls: minor accident, elderly fall, chest pain, standard night shift work. But the call that came at 11:47 p.m. wasn't normal at all. Maria Santos had joined the Army at 19. But why? It wasn't family tradition, it wasn't economic necessity. It was something else, and that reason put Maria on a very special path. She had started in the medical corps, but after basic medicine, she was selected to go further. Advanced combat medical training, the most elite program. But this was just the beginning. The real specialized training hadn't come yet. Special operations medical training, advanced surgery in combat zones, life-saving operations in field conditions. Maria was selected for the top 1%, and that training would be very useful in the emergency room that night. Her first deployment was Afghanistan, forward surgical team, performing surgery on wounded soldiers before they could even be moved to an operating table. Advanced medical procedures in combat conditions. That experience had changed Maria. Her second deployment was Iraq, this time attached to special forces, medical support on the most dangerous missions: bullet wounds, explosive injuries, complex trauma cases. And the techniques she learned on those missions weren't things ever used in civilian hospitals. Maria had taught herself to work in silence. No extra equipment, limited resources, maximum efficiency. Her hands had become instruments, and those hands would attract a lot of attention at Cedar Hills that night. Her third deployment was near the Syria border. Black operations medical support, combat surgery under fire. Maria was now competent at field surgeon level. But why had she left the military to become a paramedic? That story was more complex. PTSD, readjustment issues, civilian life challenges. Maria's transition hadn't been easy. High-stress medical work felt comfortable, but civilian hierarchy was different, and that frustration was about to explode that night. After receiving an honorable discharge in 2019, Maria had transitioned to the civilian medical field. She'd used PTSD therapy, readjustment counseling, and career transition support. Hospital nursing had been a perfect fit. It reminded her why she'd become a medic, helping vulnerable people. The hospital environment was stable, predictable, positive after years of chaos. Peace was welcome. When Cedar Hills Medical Center hired her, Maria was overqualified. bachelor's in nursing, military medical experience, advanced certifications. But the hiring committee didn't ask detailed questions. They were just happy to find a qualified candidate. Day-to-day work was simple compared to combat medicine. But she noticed things others missed. A child with unusual breathing patterns, possible asthma development, a patient complaining of headaches, potential vision problems. Maria's assessments were thorough, her referrals appropriate, her follow-up excellent, but she never elaborated about her background. "I've always loved helping people," she'd say. Simple answer, no details. At 11:47 p.m., the call that would expose Maria's 15-year secret came to Cedar Hills Medical Center. The voice from the radio was cold and clear. "Multi-vehicle accident, Highway 95, mile marker 47, 3 vehicles involved, multiple casualties, entrapment. Code red." Maria's entire body immediately went on alert. This was the reflex not just of a night shift nurse, but of someone who had saved lives on battlefields. The ambulance rolled out with sirens wailing. Jake was driving, tense but focused. Lisa was checking equipment. Maria sat quietly, but her silence was different. A warrior's silence. "This looks big," Jake said as he weaved through traffic. "We're ready for any big call," Lisa replied. Maria said nothing, because she knew exactly how big it could really get. When they arrived at Highway 95, the scene they encountered was horrific. 3 vehicles had collided in a chain reaction. An SUV was overturned, its engine block completely crushed. A sedan in the middle, its front end unrecognizable. The third vehicle, a pickup truck, had hit the guardrail and was lying on its side. Fire department teams were using cutting tools to rescue trapped passengers. Police were directing traffic. Ambulance sirens, radio chatter, the noise of cutting tools. Everywhere was in chaos. Jake and Lisa froze for a moment at the magnitude of the scene. This could be the biggest accident they'd ever experienced. But Maria was already moving. "Jake, Lisa!" There was no hesitation in her voice. "Let's triage. We'll start with the most critical case." Suddenly, the quiet night shift nurse was gone. In her place was someone who commanded, decided, whose every movement was decisive. They rushed to the first patient, a middle-aged man extracted from the SUV, unconscious, blood flowing from his head covering his face. Jake immediately began basic assessment. Pulse weak but present, breathing shallow, blood loss but... "Stop!" Maria's voice was authoritative and sharp. Jake was shocked. Maria never spoke like this. "What's wrong, Maria?" Maria crouched beside the patient. Her hands scanned the patient as if they were an X-ray machine. She checked pupil responses, evaluated skull fractures through palpation, tested neurological reflexes. "This isn't a simple head injury. Look. Pupil anisocoria, signs of battle sign, Glasgow coma score 6. This is epidural hematoma." Jake stared with his mouth open. These terms, this assessment, this wasn't basic paramedicine. "Maria, where did you—" "Jake, now's not the time to talk," Maria's voice came from the battlefield. "This man has blood accumulating inside his skull. Brain pressure is increasing. We have 15 minutes or he dies." Maria pulled advanced intubation equipment from the ambulance. Normal ambulances wouldn't have such equipment, but Maria's ambulance was different. "I'm performing rapid sequence intubation. Lisa, prepare manual ventilation. Jake, establish IV access, large bore." As her hands moved, they moved as if she'd done this 1,000 times. Laryngoscope, intubation tube, anesthetic drugs. Every movement was perfect. "Maria, you're not a normal nurse," Jake whispered. "No, I'm not," Maria replied as she secured the patient's airway. "And we don't have time to discuss this now." After stabilizing the first patient, they rushed to the second. A young woman, extracted from the sedan, couldn't breathe through her chest. Her face was turning blue, her eyes filled with the terror of death. Lisa was trying to provide basic oxygen support, but it wasn't working. "I can't give oxygen. Air isn't passing," Lisa said in panic. Maria understood the situation at a glance. Tension pneumothorax, left lung completely collapsed, putting pressure on the heart. "What do we do?" Jake asked. Maria's answer would shock everyone. "Chest decompression, immediately." "Maria, that's a surgical procedure. We're paramedics, not surgeons." Maria looked at the patient. The woman's lips had turned blue. Consciousness was becoming cloudy. She had 2 to 3 minutes left. "I'm a surgeon," Maria said quietly. Those words hung in the air. Jake and Lisa couldn't believe it. "What did you say?" But Maria wasn't explaining. She pulled a 14-gauge needle from her bag, prepared the patient's chest. "Lisa, prepare the manual ventilation device. Jake, vital signs monitor." "Maria, if you make a mistake—" "I won't make a mistake," Maria's voice was determined. "I've done this hundreds of times on the battlefield." "Battlefield?" Jake and Lisa's eyes widened. The needle passed through the chest wall. A sudden hiss sound, pressurized air escaping. The woman's face immediately began to regain color. She could breathe. "Miracle," Lisa whispered. "Not a miracle," Maria replied. "Training." When they moved to the third patient, Maria's true capabilities would be revealed. A young man extracted from the pickup truck, unconscious, in shock, with multiple traumas. "Multiple trauma," Jake said. "This is above our level." Maria assessed the patient. Abdominal trauma, signs of internal bleeding, shock, hypotension. "There's internal bleeding. Could be splenic rupture. This is an emergency surgical case." "We need to transport to the hospital," Lisa said. "We don't have time," Maria replied. "This man could die during transport." Maria pulled a large bag from the back of the ambulance. Jake had never seen this bag before. "Maria, what's that?" "Field surgery kit." When she opened the bag, surgical instruments emerged. Scalpel, hemostats, suture materials, a local anesthesia. "Maria, are you really a surgeon?" "I'm a combat surgeon," Maria replied as she put on her gloves. "And this man is not going to die." In the back of the ambulance, on the side of the highway, Maria Santos began performing field surgery. Local anesthesia, sterile field preparation, exploratory laparotomy. As her hands moved, Jake and Lisa watched as if mesmerized. "Splenic laceration grade 3, Maria murmured as if she were speaking in an operating room. "Splenectomy required." Jake's mouth fell open. Are you removing his spleen?" "I'm saving his life," Maria replied. After a 20-minute operation, Maria placed the final suture. The patient's vital signs were improving. "Done," Maria said, removing her gloves. The firefighters, police, other paramedics who had gathered around, they were all looking at Maria, the woman who had performed surgery in the middle of the street in the back of an ambulance. "Ma'am, who are you?" Maria's answer would change everything. "Major Maria Santos, Army Special Forces Medical Corps, retired." That night, 3 lives were saved. 3 people lived because an ordinary night shift nurse was actually a combat surgeon. Jake and Lisa were still in shock. "Maria, why didn't you ever tell us?" "Because it wasn't necessary," Maria replied. "I'm a nurse now." "No," Jake shook his head. "You're a legend." As the ambulance headed to the hospital, Jake and Lisa looked at Maria with different eyes. Who was this woman? Where did she come from? What had she experienced? And Maria, finally, was ready to tell her story. During the transfer to the hospital, the truth would come out. Cedar Hills Emergency Department. Dr. Harrison, the attending physician, began reviewing the cases. Who provided initial treatment? Our paramedic team, Jake replied. Dr. Harrison looked at the medical charts and froze. This is extraordinary. Intracranial pressure management, advanced chest decompression, complex trauma stabilization. This is surgical level care. Maria was quietly cleaning equipment, but Dr. Harrison's next question would reveal everything. Which one of you provided this level of care? Jake and Lisa looked at Maria, and Maria finally decided to tell the truth. I did, ma'am. This is residency-level trauma surgery. Where did you train? Maria took a deep breath. Army Special Operations Medical Training, Combat Surgery Specialist, 3 deployments. Silence. And at that moment, everything made sense. You're saying our paramedic is a former military surgeon? Not just military surgeon, special operations field surgery, combat surgery under hostile conditions. Jake and Lisa were realizing, but the real shock hadn't come yet. Dr. Harrison's next question would put everything into perspective. What rank? Major, combat medical specialist, and that rank intimidated even Dr. Harrison. Major, you outrank most of our attending physicians in combat medical experience. Maria was modest. Different context, doctor. I'm a paramedic now. But Dr. Harrison's next offer would change Maria's life. Major Santos, would you consider joining our trauma surgery department? Maria was surprised. I'm not board certified as a civilian surgeon. We can arrange that. Your experience, your skills, we need them. What would Maria's decision be? Jake and Lisa were amazed. Their paramedic partner was a major, a surgeon, a hero. Maria, why didn't you tell us? Maria's answer would explain military culture. Military teaches you don't talk about what you did. Show what you can do. And that philosophy had shaped Maria's entire civilian career. In the following weeks, Maria began a dual role, paramedic shifts and trauma surgery training. She had become the hospital's most valuable asset. But the real story would develop around Maria's impact. Maria's reputation spread. The paramedic who's actually a surgeon. Stories were told throughout the medical community, and those stories began inspiring other military veterans. Young paramedics wanted to learn from Maria. How do you stay so calm? Experience, training, understanding that every case matters. And that training philosophy would shape the next generation. Maria started a mentorship program, military to civilian medical transition support, so other veterans could find similar paths, because Maria had realized she wasn't alone. A specialized trauma unit was established at Cedar Hills. Maria became the lead surgeon. Military medical experience was being transferred to civilian healthcare. And this transformation was just the beginning. A year later, Maria became Dr. Maria Santos, board-certified trauma surgeon. But she never left her paramedic identity behind, because that experience shaped every decision she made. Street medicine teaches you differently, Maria would say. Every second counts, every decision matters, every patient deserves your best. Jake and Lisa began working on Maria's surgery team. A paramedic to surgeon pipeline had been created, and that pipeline would revolutionize the medical field. Maria's story gained national attention, a military to civilian healthcare transition success story. Other veterans were inspired, but Maria's greatest achievement was yet to come. Maria now trains combat medics transitioning to civilian healthcare. The circle was complete. Your military service doesn't end with discharge, Maria tells them. It evolves. Your skills, your dedication, your service mindset, these transfer. Those hands that had performed surgery in combat zones now train the next generation, teaching precision, instilling confidence, sharing expertise. Jake and Lisa are now Maria's closest colleagues. We learned from a legend, they say proudly, because that's what hidden legends do. They don't hide their past, they use it to build better futures. In Maria's office hangs a single photograph, her military medical team in a combat zone, a reminder of where her skills came from, inspiration for where they're going. So I ask you, have you ever received medical care from someone like Maria? Healthcare providers whose military background you didn't know? Where you only saw exceptional competence? Share your experiences in the comments, because here at Hidden Legends, we know that the greatest healers often serve in the most humble roles. If this story moved you, share it, subscribe, and help these important stories continue. We'll see you in the next legend. And until then, remember, your healthcare provider might have saved more lives than you'll ever know. Service never stops, it just changes uniforms.